Keris Myrick is a leading mental health advocate and executive known for her innovative and inclusive approach to mental health and substance abuse reform and public disclosure of her personal story. She's the developer and host of the podcast Unapologetically Black Unicorns, which focuses on mental health, race equity, and lived experience. She is certainly an in-demand national speaker and trainer, and she's authored several peer-reviewed articles and book chapters that really look at the intersection of peer workforce, lived experience, and technology and mental health, which is again something you're seeing that's coming up in these talks over and over again. She is the senior vice president of partnerships at in innovation partnerships, sorry, and innovation at Inseparable, and serves as a clinical advisor in division of digital psychiatry. She has over 20 years of experience in innovation, transformation, and the peer workforce. She's worked for different government agencies, different state agencies. So I think that Keris brings a really unique perspective from kind of going from the halls of Congress to working with people one-on-one about technology. And for this one, we're actually not going to share slides. We have some questions we're going to discuss and
Mhm.
talk about. So Keris, just
Yeah.
you've heard these five talks so far about different aspects of technology. No one, right, is saying that AI is going to become a therapist. I have not heard that yet. We've heard different parts of what it can do, but we know that a lot of stuff needs to be better. We've heard some hopeful stories. We like those. But what does the lived experience movement, what is kind of the thing that you want to see happen now? And maybe we can explain just like what is the lived experience community and then what could or should they be doing?
Yeah, sure. So first of all, thanks for inviting me to come and speak. And I'm glad everybody like lined it up so we could have this last because we were getting to that listen to the people who are the users of these to hear what they want. And I think so when we talk of lived or living experience, we're talking about people who have mental health and or substance use conditions, may think they have mental health and or substance use conditions, and they're living that direct experience of those conditions or having mental health issues. And I think what I've heard, and it's mixed, like we're not a monolith, let's just be clear, right? But I think just like, everybody else, there are particular things that folks are interested in around privacy, safety, those kind of protections, who owns the data, what happens to the information, will this thing discriminate against me, those kind of things. And I think those are some of the things that are coming up. And I think particularly for people, who have had, I would say, negative interactions with things like call centers or things like that, their concern is how is this data used? And it may have a false positive of me being in crisis and then send the police, and the next thing you know, I'm in a locked unit. Yeah, so that's very frightening for people. And also, how does it even understand who I am, my culture, the context in which I live, and then have those kind of interactions that are culturally competent, and again, not have any other issues. So I think the most important thing people want is number one, ask me what I want, right? Like, don't assume I want something, whether it be how I'm going to use AI in an interaction for emotional support, or how AI may be used on me in an administrative role coming from either, a system or Medicaid or something like that. So asking folks first, what do they want? And then listening to what they say about that, and responding to that or acting on that. I also think involving lived experience throughout the entire process, from ideation, development, testing, research, feedback, etc., is what people are asking for. They're not asking to be involved after the fact to give feedback, but to actually develop the thing they're interested in. And lastly, to serve as supporters for others if they have an expertise in using these tools or learn how to use these tools. How can they help somebody else in using these tools? So, yeah, that's where I'd start.
It almost kind of ties back to the digital navigator that Somia talked in the first talk of who better to kind of equip and help navigate this world than people who know the conditions of the tools for it.
Yeah.
One thing that you've been very clear for many years explaining is words matter. Chatbots can deliver words. And here we are talking about in this field AI psychosis, right? We're talking about hallucinations. These are very loaded words that mean different things and have stigma attached to them. How did we get to this place of using these words, and can we do anything about it?
Yeah, I'm not quite sure how we got here. Maybe it's like, we're always looking for shorthand to be able to explain something that maybe is a bit more complex. Especially, thinking of the journalist, you got like how many words you got to get something in, or if you're writing an article, you only have but so many words, so you try to shorten it. And I think that's what happens. And so, when I first heard it, I was like, wait, what? I don't what? Like, what is AI psychosis? What is AI hallucinations, etc.? Are they talking about the AI hallucinating? Are they talking about the person experiencing hallucinations because of interacting with AI? Sometimes I can't figure it out. Sometimes it's a both and. But at the end of the day, I think, I would hope that the language that we use doesn't train or trick people into thinking that the machine is human, that the machine can have these experiences because the machine can't. It's a machine. And I think that's part of our why people engage with these things because they feel so human. And then they get maybe tricked into thinking they're human, right? But they're not, they're a machine. So I think the way that we talk about AI and using terms like hallucination, psychosis, etc., may anthropomorphize the technology and blurring the line between a human experience and a mechanical function. So maybe we should use more accurate terms around maybe like what AI is doing is my friend used to say, "Oh, they went to MSU." I'm like, "What's MSU?" Politely put, making stuff up. So maybe AI is taking the information and making stuff up, or maybe more technically, they're having a mechanical misfunction or something like that. They're having a error, whatever the right term is for the AI. I think for the person, what I guess what I'm struggling with is we don't classify any other type of hallucination, psychosis, or delusions. We don't say, oh, she's having family delusions because my family may have caused a delusion I'm having. We just say, oh, yeah, she has delusions. So
Yeah.
that's where I get a little confused about when are we going to do this and when are we not. But at the end of the day, I think what we don't want to do is trivialize what it feels like for people who experience hallucinations, delusions, and or psychosis, which this may inadvertently be doing.
Yeah, no, it's not the ideal language by any matter. And in trying to think about getting AI right to support mental health, you've done a lot of work in the app space. You were kind of far ahead of all of us in seeing the potential of apps. You've shared your story about you using apps in different settings. What are there any kind of takeaways we can learn from the app space that you go, oh my gosh, we saw this happen already. We need to kind of be aware or apply it to what's happening with AI today?
Yeah, beyond the start with the lived experience, I think one of the things that we discovered when we were doing a project trying to expand the use of digital apps, digital therapeutics in public mental health is we thought everybody had a smartphone the way we had smartphones, and they were hanging out, kind of using their smartphone, pulling it out of their pocket, so that this became an easy way of thinking about how to extend what we were doing in person to what a person could do on their own. Well, lo and behold, just like the first speaker was talking about, we have people who do not have a smartphone, do not have a phone, do not know how to use technology, do not have bandwidth. And that was actually to the folks who thought of this project, that was shocking to them. It wasn't quite shocking to me. I'm like, people live on reservations, people live in rural areas, people live in poverty. So they don't have what we have or what people who may be more privileged have and use it in the same way. So, we wanted to make sure that to think about people having the knowledge, skills, abilities, and confidence to actually use the technology in safe ways. We also found out that providers didn't know how to use the technology either. So as we were introducing telehealth because there was no choice, everything was shut down. The providers also didn't have the knowledge, skills, abilities, or confidence. So that really led us to think more about how can we support folks utilizing technology, because once we open the door for many who hadn't done this before, it can open the door to like going down that rabbit hole of all the other things that may be in the App Store or other things that are online that folks might want to be involved in. So I think that started us on this trip to thinking about digital literacy and digital citizenship, which we'll talk about a little bit later.
And it's a fair point that clinicians need to learn a lot too. I think I'll speak as a clinician. We're very prideful people sometimes. We don't like to say that we're confused or we don't know things either, but there's a lot to learn in even the world of apps, let alone AI. But if the clinician doesn't feel comfortable using it, that's going to be a tremendous
Yeah.
barrier again. But let's also jump to, again, you kind of allude to this idea of digital literacy. We're getting to a world, not everyone has a phone or internet connection, but it's getting cheaper and cheaper and more accessible. But the kind of invisible barrier that may not be as accessible is the digital literacy. And I'm just thinking of all the kind of fake images also that AI just produces today, or sometimes I'm like, is that one real? Is that not real? Where does digital literacy fit into this kind of discussion about AI? Like AI is the most advanced thing, and here we're saying digital literacy is the basics. How do we bridge those?
Oh, yeah. Well, I think part of digital literacy has to include AI, right? I think it's an imperative. I don't know if it does now because it's kind of like, I mean, speaking back to what we did here in California, we had to create a digital literacy curriculum to train our peer workforce and our community health workers in order to support the people who needed to get access to telehealth and then beyond. And we also did train the psychiatrist too. So that was kind of fun. But it was also important because
Yes.
psychiatrists saw people with lived experience as more than their diagnosis. They saw them as experts who could help them actually be better able to use the technology. So one of the things that we also did is we created for our peer workforce. We're the only state that has it so far because we're one of the last states to have a certification. But CMS requires us to have core competencies and training. And so for our peer workforce, we're the only one in the United States that has digital literacy as part of our core competency for our peers that are trained and certified to work with folks in public mental health and bill Medicaid. So I think that's a huge win. And I'm hoping that talking about AI, unpacking what it is. We say AI, but what is it? Like, I think
Yeah.
people might have 10 different definitions of what it is or what it looks like. So even starting from there, so that people then can have a level of confidence about, do I want to engage? Don't I want to engage? How deeply do I want to engage? When do I want to pull back? When is AI trying to suck me in, like trying to act more like a human and giving me what I want to hear? What do they call that? Syncopathy? I can't say the word.
Yeah. I think
Yeah, but
exactly.
yeah, doing that. Like I
Yeah.
want to know that it's doing that and I want to not engage. Like at that point, I know I need to be careful, but only if
Yeah.
somebody teaches me that. And
Yeah.
also, what digital footprint do I want to have online? That's sort of digital citizenship, if you will. So, what
Yeah.
kind of footprint do I have online? Everybody will be a little bit different, but knowing and having the knowledge to make wise choices as a quote unquote consumer of the product, as a parent who's helping someone, as a teacher who might be talking to a student, even as a provider who's supporting someone else, I think is critically important.
That just makes sense. New tools, we all need new skills and everyone partaking in the healthcare system. As we're kind of talking about AI, right? It's a new way to reach people, to interact. And I think clearly we need to get the message out more about these tools. And you clearly have embraced the podcasting world and done it. What is it kind of just like to run a podcast and to reach people in that way? Or give us a couple kind of insights into this special hat that you wear.
Yeah, so the podcast Unapologetically Black Unicorns was started during COVID, like every other podcast in the world. So, here in my little studio. It's not a studio. It's my second bedroom. Come on, let's be real. But anyway, but it's been really important to capture the stories of people maybe who are doing amazing work in mental health, but who may not be lifted up and you don't hear from them. Primarily people of color, primarily it can also be people of color in psychiatry or pharmacy or whatever, where there is again sort of disparities or kind of you don't see a lot in the population there. So that was one thing. The other thing that I think I've been enjoying and having fun with talking about AI is sometimes I don't have a guest. And so, or have a topic that I'm really interested in covering, but I have to be careful about how I cover it. And so I take sort of a parody approach to it, Parody, not parody, Parity, parody approach. And I will go into ChatGPT and say, hey, I want to cover this topic. This is my guest. This is how I interpret how this guest might be. They're curmudgeon-y, or they're this, or they're that. And here's my side of the conversation, the questions and topics I want to talk about. Now create the script for for this AI person.
Oh, wow.
I do have a couple of episodes where I am speaking to Medicaid. For example, Medicaid's not a person. They're people that work there. There's a director. They would never get on my podcast. So, and I'm not saying that this is how Medicaid would respond. I wanted to know how Medicaid felt. And so I had this AI conversation. I got an AI voice. I was very clear at the top of the episode that I was using AI to kind of have this fake conversation just to make my point. So I've
Yeah,
done that a couple times.
that's pretty cool. I'll just say to use it in
Mm.
that way. And I think I'll just speak for you probably if anyone people can email you if they're interested in being on the podcast, perhaps.
Yep. Always looking for guests. So feel free to email me.
And then maybe one last question. I feel like you're always on the move in different parts of the country doing cool initiatives. What are you doing kind of right now with Inseparable, or what are the kind of things on Keris's Myrick mind as of December 12th, 2025?
Yeah, vacation. Oh no, that's not on my mind. Yeah, I think so for Inseparable, we've been paying attention to we work in the policy space, we work state by state, we do some federal work. We've been paying attention to a couple things in this space. Number one, looking at who should have oversight over these kind of tools. Should it be at the federal level? Should it be at the state level? Should states be able to decide through legislation what kind of guardrails they want to put in? Secondarily, we've seen some states already put some guardrails in that look like full out, yeah, nobody under the 18 shall. Da, da, da. Helping to also think about, is it a writ large, no young people should use, apps, or should it be, a guidance around how to think about which apps to use and to continue to get more research around how these things can be used. So those are some things that are kind of on our minds in this particular space. And then for me, I think it's still, how do we have policy aligned recommendations for legislators and agencies? And we can include lived experience as part of that legislation recommendation. Yeah, I think that's kind of what I've been doing.
That's that's a lot for right before the holiday season
Oh, you know
itself.
what, Dr. Torres, there's one
Yeah.
other thing. I'm making sure that we do not dismiss the fact that people with schizophrenia can and do use technology. I am
Yeah.
still running into folks when I talk to a telehealth company, and I ask, oh, so who do your providers serve? Real life providers, not AI providers. And they said everybody except people with schizophrenia. And I was like, eh? And they said, yeah, it's not clinically advisable to work with anybody with schizophrenia. And I said, anybody, even if they're doing well? And she said, oh, yeah, we can't work with anybody with schizophrenia. And I'm like, you're talking to somebody with schizophrenia? This is the most bizarre conversation I've ever had. And I've had some bizarre conversations. So yeah, that's something else I'm still working on.
Yeah. And I said, thank you for sharing so much. We have time for probably just one question, but you've covered so much. And th this is a question going similar. Schizophrenia is a term that's been applied in many ways. Again, some perhaps appropriate, some bit not appropriate. We kind of talked about AI psychosis. just like what, again, if you had to throw, what are some better terms you think, again, we could be using, or just to kind of stimulate the audience of like, what would we call it? So we could call it just like lying. You gave the MSU example, but like,
Yeah.
if we had to put a proposal forward, what would we kind of suggest that we think about?
Yeah, I mean, I definitely think I don't think it's lying. I think that's a pretty, I think that's a pretty strong term. But definitely there's some kind of machine error that's not grounded. So whatever tech, like I'm sure the tech world, they may have used psychosis, but I'm sure the tech world was not using the word hallucination. I don't know if that started in the mental health world. So I think at the end of the day, we need to call it what it is from a tech perspective. We in the mental health field need to understand that terminology, not impose our terminology into the tech field.
Yeah, no, I think, and I think that change is going to happen too, because it's also just a word that we don't understand what's happening, right? Because again, the technology can make mistakes, and if we have these terms that don't help us understand what's happening,
Yeah.
it's not productive for any single person in the space. So with that, thank you as always for sharing so much about the space.
Yeah.